Welcome, everybody. I hope you're having a great September as we head into fall. It's nice to be out of I don't know about Sam down in Florida, but it's nice to be out of the really hot weather and into some fall foliage and so on, and the cool weather. So for those of you who are not tracking, this is actually our last session in this series together. Oh, Mary just gave me an O, so I believe that I'm providing new information. So this is just a reminder. Sam is going to come on later in a few minutes and talk a little bit about updates and next steps. And our goal is to elicit some information from you so we can make the planning as we move forward as customized to your needs and where you're at as possible. So I want to welcome everybody again. I'm Michelle Zabel. I've been your facilitator and host for this whole series, and I'm really grateful, as I say every month, but I'm going to say it again. I know how short-staffed you probably all are. I know how busy you all are. I know your competing agendas are always a priority. And so you guys stopping and joining us and really engaging in this opportunity is I'm just always grateful for, and really hopeful that we can utilize the partnership between SAMHSA, NIDA, and NIH and IMH to of benefit, particularly to you guys and the systems at large for informing how to best implement and use implementation science to improve outcomes for those who access services. So we have a full agenda with, as I promised last month, the majority of time in our breakout rooms. And so I want to do what we always do and do a quick Mentimeters with you guys. So we're just tracking where everybody is at. It was great for those of you who sent in some additional aims statements and or your research questions. Every month there's more and more, and so we're just really happy with all of that. So please, Gary just dropped a Mentimeter link in the chat. There's the QR code at the bottom, but if you guys could just give me an update. Was the information presented in the last session a month ago when we did the breakout rooms with Kimberly Hoagwood and Eric Bruns helpful at this stage of implementation to your agency? And I'm hoping it was, because we're kind of replicating that this month. So I'm hopeful that it was. If everybody could start the Mentimeter process, that'd be great. You know, I can sit here and wait. So I'm hopeful people will do this. Okay, I don't see anything yet, Gary. If anybody
to get your phone out and join it.
I know, you got to get your phone out. It's the same gig every month. Get your phone out.
I did it. So there
you
go.
Okay. There we go. Thank you, Mary. Yeah. Great. I'm glad that folks were feeling like it was helpful. And for those of you that it wasn't yet helpful, again, when Sam comes on, she's going to ask some very specific questions about what's next. Like, how do we dig in and really help you move forward? The next question that we ask every month is, did you share any of the information that you received last month with your agency? As a reminder, last month you really didn't get PowerPoints, but you got a recording of the session. And so, as always, we're encouraging you to actually, thank you. Oh, it's going fast, Gary. We're encouraging you to actually send it on. So one person used the information. I'm thinking that's Mary filling out the Mentimeter, but we'll see. I'll give you a second. I got more than 3 people last time, so I'm hoping for more this time. All right, I'm going to keep us moving so we're not stuck. Not yet. A couple of people not yet, which is completely understandable. And then where are you at in your implementation science pilot development? So we've got someone who's currently designing their research project with a research partner, which is phenomenal. We've got people who've submitted, which last month I think was the first time we had a few folks submit, which was Sam and I were very excited about that. And then we've got folks who are filling out the template, folks who haven't engaged with the researcher yet, and someone who's still working on the project template. So thank you for giving us that information and feedback. And the next question, a couple people doing project templates still. The next question, Gary. You want me to wait?
Yes, we're moving over to Sam.
Oh, okay, great. Okay, so all of this is helpful. As a reminder, we gather this every month so that it gives us a baseline along with the evaluation. I'm going to remind you that at the very end, we'd love you, particularly since this is the end of the series, to stay on and complete the evaluation. And next, I'm going to hand it over to Sam. There's a ton of updates that she can provide.
Wonderful. Thanks so much, Michelle. And I'm sorry for folks that I wasn't able to join last month as I was traveling, but I heard it was a wonderful session. So I want to provide updates on a few things today. And there's some places where we don't have exact answers, but we will be working on getting them to you. So just throwing that out there up front. First and foremost, as Michelle noted, this is the last session of this series, quote unquote. So when we received the funding to support the evidence-based practice implementation science project, it was only through September. That being said, this is not the end of our support right now. SAMHSA has continued to invest in this as an important priority, and there is another opportunity for funding for us to continue to support you all under a different funding mechanism, as the National Council has been awarded the CCBHC State Training and Technical Assistance Center. So there is some transition that we're doing in terms of getting ourselves up and running to support you all through a different funding mechanism. And there is some time needed to do that in terms of sitting back, reassessing where we are, and designing what our plan is for the next year, which is why your feedback is so important. And after I talk a little bit, we'll do some Menti to get additional information on what you think would be helpful. But just be thinking about that throughout this session, or reach out to us after, in terms of, as we move into the next phase of support for you all, what do you think would be most meaningful, right? Is that continuation of bringing you all together as a cohort and hearing from research experts? Is it more space for peer-to-peer engagement? Is it more kind of directed, individualized support as you are partnering and submitting proposals? Is it more kind of on-demand resources? Is it a mix of all of those things, or something else? We definitely want that feedback. That being said, the CCBHC NTEC is still here during this kind of transition where we're sorting through the next phase. And I want to encourage you all to utilize us as continued support during this bridge period. So you all should be pretty aware at this point, or I hope you are very aware, that the NTAC offers individualized consultation to any grantees on demand whenever they need it. And so this is part of that offering, right? As you're working through your implementation science pilot work and wherever you are in those phases. So what I will say is, you have our contact information. You will be hearing from us in the coming months as we kind of launch into the next phase of work. But if there is questions you have in between, please, please, please reach out to us. We want to make sure that you're clear that if we need to hop on a call with you, if you need help in kind of like working through research aims or brokering conversations with researchers, you can continue to reach out to us for that. And I don't want to speak for Hillel, but I'm sure SAMHSA is also encouraging in the same fact of, if there's anything that you need going to your GPOs as well. And between the two of us, we can figure out how to best support you. So I just wanted to throw that out there. In addition, there has been quite a few resources that we've been developing over the course of this time, and we are very hopeful we'll be ready for public consumption in the next month or so. That includes a few different things. One, an evidence-based practice implementation guide. So that guide is really going to synthesize a lot of the content that we've covered over the last few months and put it into one place and really support you in accessing resources that can support your needs assessment and your selection of EBPs and your establishment of your implementation models, and how to utilize implementation science frameworks to really shape your EBP implementation. We've also developed, and these are all kind of in a process of final design and review with SAMHSA, but we developed a suite of resources that can help with EBP selection, because that was a common thing that's come up the past 2 years. We've been engaging with grantees at large, is kind of the amount of work that you all tend to do in your own research and having to identify what are the right models or EBPs to be matching to our populations. So there's going to be 2 tools that we'll be coming out with. One is a selection framework, which helps you assess multiple EBPs against priority decision areas to determine if it's maybe the best fit for your organization, as well as a cross-reference guide, which I think has about 30 evidence-based practices listed in it with comparisons across a variety of factors. That includes what it is, what populations, what settings, what are staffing considerations, what are training considerations. So hopefully those things will really help you in your selection of your EBPs. And then finally, we're going to be developing a research practice partnership resource. So again, that's going to synthesize a lot of the things that we've talked about over the last few months, and will really help you think about, what is the role of a researcher versus an agency? How do you look for the right partnerships? What are some approaches to brokering those relationships? And then as you move into implementation, how do you continue to develop and manage your relationship as research practice partners? So just wanted to forecast those all for you. And many of you, I think, are already on our listserv, so you'll see them as they come out, but we'll also do a targeted bump to the folks on the learning community to make sure that you see them once they're live on our website. And I'll stop there for a second and just see if there's any questions or anything that others want to add on the line. And then we'll move, I know Gary just bumped another mentee, and we'll move into just feedback.
Right outside my bedroom, it's broad daylight, and you have cameras. These 2 little shitheads see my car running. But this when I'm walking out the door and I do see
Faith, I think, okay, I think she was not unmuted on purpose. Sorry about that. And Megan, I see you're off mute. Did you have a question?
Nope, sorry.
No worries. Okay, so let's move into the mentee then. Gary, if we go to the next slide. Okay, so what else do you need moving forward? Individualized TA, support to connect to researchers, ongoing peer-to-peer learning opportunities. So I love seeing that there's a continued interest in kind of meeting as a cohort. And so as we start conceptualizing and launching our next phase of this work, that will definitely be central to this. Like I said, individualized TA, I think, can be an element of that. And again, if in the next few months, while we're moving into launching the next phase of this work, you have any questions, please reach out. We still have a mechanism for supporting you. For those of you who are looking for support to connect to researchers, I think there's a few things that we can do there. Again, like that individualized support, I know that I've connected with a few folks who have, we've talked through some of their interests, and I've just used my own connections to kind of triage, who might be interested in partnering with. I know our UConn folks have done that as well. And then I know the NIH and SAMHSA teams are also really invested in continued work to support those efforts. So if you have interim needs on that, please reach out and also include your GPO on that ask. And we'll continue to identify opportunities for supporting those connections. It could look like a few things, right? It could be another bump where we're really engaging the research community and pushing them towards the database. There could be some more targeted matchmaking that goes on. I think right now, as we're formulating our plans for the next phase, nothing's off the table. Michelle, do you have anything to add?
Well, I'm just wondering if folks would mind, like, whether you want to come off mute and give us some reflection or drop some ideas in the chat. This idea of an ongoing peer-to-peer learning opportunities, I'd love to hear from some people what the, is there specific content that you're hoping gets presented and discussed? Is it really kind of group format where it's a lot more, a lot less structured and peer-to-peer? Just any of your thoughts about how to best use time. When we're pulling you all together, we always want to honor, the time you're giving us and your peers. And so guidance around, we probably should have done like way more specific questions for like, if you want peer-to-peer learning, what does that look like for you? So whether you are able to drop it in the chat, able to come off mute, I'll be quiet in about 2 seconds, or you want to think about it and email, National Council or me, please feel free to do that, because we do want to design this in a way that is most effective and most honoring of your time and your commitment. So
I agree with that. Thanks for putting that out there, Michelle.
Mm-hmm.
I guess my biggest thing is when we do the peer-to-peer discussion, that we have really good discussion topics. I think that everybody, has a very similar question, and we can come together and discuss those with also somebody kind of in charge of mitigating that discussion as well. I know because I really don't like the peer-to-peer discussion, and it's really hard to get, people to talk and speak up. So
Sure. I appreciate that. It's a mixed bag with peer-to-peer, right?
Yeah. And I
It's
think
great to be together, but it's got, being on the same page and prepping for that is really important for it to be effective. So I appreciate you putting that out there. Yeah. Anyone else want to jump in and give us some thoughts?
This is Courtney. Share that I felt like when I'm not always a huge fan of breakout rooms, but when they're well facilitated, I think they're great. And we had a collaborative recently, one of the meetings where we were in a similar cohort in stage, and it was really nice to hear from other organizations just a brief blurb about their project. And I think when there is maybe considering a very short format where a couple of folks present what they're doing, ask a question, we learn from each other, might be a nice way to go.
Great.
That's
really helpful feedback. Thank you. If it fits with what Mary dropped in the chat too, about hearing where you're, as peers, where you are with your research plans, and then talking about next steps, or, having that specific facilitated conversation, Courtney. So you two are on the same page, I think. Others?
And I'm just taking some notes over here.
Yeah. Okay. Well, I don't want to drag this out, but thank you for your feedback on that. And as you think about it, if you have other ideas or really specific guidance, that'd be really great to hear from people around that. Okay. So Sam, are you good? You have other things you want to tell people? Or are you good?
I'm good. I think we can move along.
Okay. I'm just going to remind people, even though you all know this and Sam said it, that during what looks like a government shutdown, the TA Center is still open and available and capable of responding. So please, remember that and reach out. Okay, so we're getting to the meat of today's meeting, which is peer-to-peer time in breakout rooms, Courtney. So hopefully this goes the way that it's helpful to you, and that it's a successful breakout room for everybody. So like I've said to you before, as we've invited people to present, or like we did last week, we've really looked for people in the field who were doing the specific work on the content area, and a little bit look to people who had tentacles and connections, so that if they heard of your project, maybe they had junior researcher or somebody in their world that they might want to make a connection to as well. So it's always a double ask when we invite people. But today I'm so happy that Dr. Mary McKay and Dr. Bruno Anthony have agreed to join us, both great research leaders in our country and well funded from NIH and NIMH. And so I have had the luxury and benefit of working with Bruno now for 18 years, Dr. Anthony, and I've known Mary and her work and been around it, been a beneficiary of knowing it for probably 16 years, Mary. So that is my reason for reaching out to them and asking them to be part of this. And I just want to take 1 minute because I don't want to read their bios to you because they're very long. If you look at Bruno's, even his title is too long to read to you guys. So if I could ask them to come off mute and give a quick introduction of yourselves, how you want these folks to know you, I would very much appreciate it. So Dr. McKay, do you want to go first?
Sure, I'm happy to. So hi, everybody. I'm Mary McKay. I am at Washington University in St. Louis. Right now, I am in our Provost office, and I am driving forward our university strategic plan that really centers on research excellence. By way of introduction, all of my research career has focused on child health, well-being, really coming up with approaches to family and community strengthening to help kids and families be well. Most of my portfolio is funded by the National Institute of Mental Health, although I've had the privilege of having funding from NIDA and from other collaborative sources around the NIH. I'm particularly known for collaborative research. So in my world, if you're going to come up with new solutions for children's mental health or adult mental health, you need to work intentionally with those consumers of services, those directly affected, the providers, institutions. And so I'm really happy to help this group translate their ideas into research studies that NIH will care about. So we'll try to have a lively discussion in our breakout room.
Great, thank you very much. Bruno.
Hi, everybody. I'm Bruno Anthony, and my God, 18 years. Phew, Michelle.
We've survived it.
I didn't know you were that old, Michelle.
This is why I keep working with you. Thank you.
Well, anyway, I'm Bruno Anthony, and yes, it's too long to read all those things that I do here at the University of Colorado. But what I'm really interested in and have been for a long time is mental health services research, and particularly around the design and implementation of evidence-based practices in community settings. And those have included community mental health centers, it's included primary care, and the schools as well. One thing that struck me I think I started 18 years ago or more, doing really developing interventions. But we're at my feeling is very strongly that we're at the stage where we kind of know what works. And it feels to me that there's less of an emphasis on really developing new interventions necessarily, but really figuring out how to make them work in different settings. And that's kind of what I'm involved in now. And we have projects sponsored by the National Institute of Mental Health, PCORI, and actually state funding too, focusing on interventions like peer support, suicide prevention, tiered care coordination. And, it's just really exciting to work with folks who are really involved in how to make things work. And I will put a call out to one of our great collaborators here at the University of Colorado called ACCORDS, which is the Adult and Child Center for Outcomes Research and Delivery Science. I had to read it because I can never remember what that says, but they actually are an incredible national resource. and they provide lots of online training around implementation science from the basics to more advanced stuff. But I would actually suggest you look at their website and kind of see if you're interested and kind of see if there are things that might be of interest to you. So I'll stop there.
Great. Well, I appreciate both of you being here, and I know that the rooms are going to enjoy their times with you. So let's get you over there. So we have Dr. McKay going into the partnered room. So any of you, I would ask any of you who sent an AIM statement, who sent your research questions, or have a research partner that you're in the process of developing those, please go to her room. And then the pre-partnered room is Dr. Anthony, and that is us talking about your desires, what your research questions are, and getting maybe some helpful ideas around actually identifying partners for you and figuring out next steps. So we're going to give you a good amount of time in the breakout room. We'll monitor it. If Sam will be with Mary and I'll be with Bruno, and then we'll come back together, do a bit of a debrief. You'll do the evaluation for our good friends at MPHI, and then we'll let you go, and be very grateful that we got this time with you. So Gary, take us away. So thank you so much. Thank you again, Mary and Bruno, for lending your expertise. I hope that the partnered rooms dialogue was as robust and impactful as ours was. I'm wondering if we didn't in our room pick a presenter or a reporter outer. So I'm just wondering if anyone has any reflections or comments they want to make before I call on Mary and Bruno to do that. Maybe Sam too. Anyone from the CCBHCs want to give any feedback on the conversation? Thoughts?
I can jump in to get us started. Just want to thank everyone who engaged in our breakout. So being in the partnered room, I think we have a lot of folks who are farther along, right, and are going through research design, and some things that came up on both ends are just, concerns about capacity and workload commitments. Sure. From an organizational standpoint at CCBHCs, it's, how do we bring folks along? How do we design this in the least burdensome way? And then from the research perspective too, like how are we effectively communicating and collaborating? So as to continue to have folks wanting to engage with us, and what can co-design and some of that look like? Mm-hmm. And then I think there was just a really insightful question and conversation around, for those who haven't participated in this type of research before, what can you expect throughout this, right? As they're designing their research project, where is there places to push back? Or what parameters should be set, or what should they be thinking about in terms of movement into implementation? Should they be funded that they should be thinking about as best practices now? And what does that mean? So I think that was a really robust discussion too, knowing that those things are not one size fits all, but how do we learn from those who have been there before? So those are two big things. I think the other thing to just flag, for our team in terms of thinking about next phase, and I'd be curious about others' feedback, is obviously along the learning community process, we've been engaging with this cohort on the line, and you're all amazing, but you're all at different stages. And so for those who are farther along, I think there's pieces of what we've been working on that has felt like they're already ahead of it. Mm-hmm. Or I wish we knew that sooner. And so timing is so critical, right? So is there opportunities to maybe think in different cohorts or provide different types of support in the future as we iterate and go into our next phase of working with you all?
It's great.
I don't know, Mary, anything to add, or anyone else in the room?
I think the only thing that I would add has to do with, we had a fairly rich discussion that will stick with me for a while around kind of just burnout and fatigue, and really aligning the work in ways that are not burdensome. In way, and then also, are we doing enough to be sure that some of our implementation interventions are creating enough space to learn and grow? And I heard a couple of innovative ways to do that. One was to actually, have staff have direct experience with this intervention themselves to help them emotionally kind of get more support and regulate. And but I think that this is an area of science that we haven't actually paid enough time, looking at staff experience and really creating, the extra time and space to do this well. And so can we leverage some of those research resources to be able to not only study that, but to do that and study that so that our staff can have a better experience. Yeah.
All great comments. Anyone want to add to what Mary and Samantha provided? All right. What about from the pre-partnered room? Anyone want to jump in? We were very focused on trying to move people into the partnered room. So, Bruno, what would you like to let people know?
I was just going to comment on Mary's comment, actually, that
Sure.
one of the nice things about the movement towards implementation science is that you start paying attention to things like burnout and how providers feel about doing things, and the patient and provider characteristics. And that's kind of what I think many of the projects that we were just sort of thinking about had to do with how to better implement interventions with diverse populations, which I think is another a thing that implementation science has really helped us to focus on as well. I think that, it is hard when you're starting out to say, well, I'm not even sure what my first step is. And I think that we were able to maybe help a little bit with that, but I think it is often daunting and keeps people out of being able to find out information in the research setting. So I think that this is a great program to really help people take that first step, which I think is really critical.
Right. We paired people up. We made promises to introduce people to other people. We did all the very operational first steps of how can we help right this second? So I don't know if anybody from the pre-partnered room wants to say anything. We'll give us a second of space for you to jump in. Okay, well, Bruno and I left with the to-do list, and we are promising to fulfill that to-do list. So, okay, you guys, so you've got out of this time that we've spent together a whole series of webinars that I hope you disseminate to staff. If you have new people, that starts you off on what is even implementation science, what the heck is this thing, all the way to how to identify researchers that fit the culture of your organization, and through the phases, how to set up your CQI system so you can use your data, and all the way through to these last two sessions where we tried to put you in the room with some folks who could give you guidance on setting up the research design and identifying who these research partners are. So, use the National Council's website for you. Please disseminate it. If you have new staff coming on, if people are confused what you're trying to accomplish, please use all that. Sam gave you earlier in our session together some additional resources that will be coming out. I think you'll find them all very helpful. And again, I guess my last call is just that if you would please think about this next opportunity for support for yourselves. We ask you kind of in 3 big buckets. I appreciate your responses on all of those, but the details of what would be most helpful, please just take a second, think about it, and email Sam or Amanda or Kat or somebody from the National Council to say this is what would really be helpful, because I try and say this every time, but I do want to honor the time you spend in this. We don't want to convene people to convene people. We know how hard it is for you out there, and the not just the emotional burden that you're carrying, but the fact that you probably aren't fully staffed. So those things combined it's a lot. And so I'm just grateful you spent this time with us over this series. Hopefully you got work out of it, stuff out of it that'll help you. And we look forward to seeing you in the next iteration of support that we provide to really accomplish this work. So thank you, Mary. Thank you, Bruno, for your time. Thank you all.